Wait. Okay. Okay. Good morning, everybody. First of all, I would like to thank the President of the Congress, Professor Naji Al-Abadi, and the Organization Committee for inviting me to attend and participate in the 12th annual meeting of PANS. Mr. President, dear colleagues, we will talk to you about retrogastrian balloon compression for the treatment of the trigeminal neuralgia, series of 1,080 cases managed in the neurosurgery department of Salim Zmili Hospital, Algiers, Algeria. The first treatment is the medical treatment of the trigeminal neuralgia. After is the surgical treatment, balloon compression, thermorhizotomy, glycerol injection, radiosurgery, and finally microvascular decompression. Choosing the treatment is very important. In our department, we performed thermorhizotomy in 88 cases, microvascular decompression in 30 cases, with preference for the balloon compression in 1,080 cases. We have no experience in glycerol injection and radiosurgery. We cannot talk about percutaneous technique without mentioning the name of Sweet, who performed for the first time in 1974 the thermocoagulation. The glycerol injection was introduced in 1975 by Atkinson. The radiosurgery was performed for the first time by Lexell in 1971. Addition to that, balloon compression was introduced as a treatment of the trigeminal neuralgia in 1984 by Mullen. We propose the balloon compression when there are failure of medical therapy, when the patient has major medical comorbidity, just like the young lady on the right who has gingival hypertrophy due to the DEDN treatment, when their previous failure of microvascular decompression. Our city with 1,080 cases, which were managed from June 85 to December 2017. It included 628 female, 452 male, aged from 16 to 88 years old, with a mean age of 52.4 years old. The right side is affected in 632, both of sides in 5 cases. This table resumes the territory of neuralgia. As we can see, the 5-2 territory is the most affected, alone or associated with another territory, V1 or V3. The V1 territory alone is rarely affected, only in 15 cases in the right side. At 1 month's follow-up, the results were excellent in 990 cases. 84 patients were considered treatment failure. It was impossible to cross the foramen oval in 22 cases, hematoma of the cheek in 24 cases, atypical trigeminal neuralgia rectified diagnosis in 12 cases, atypical balloon shape in 26 cases. The results after 1 year is excellent in 67.6%, satisfactory in 12%, require small posology of carbamazepine. After a follow-up of 16 years, 50% kept the benefit effect of the first procedure, and 15% require small posology of carbamazepine. The recurrence were observed in 78 cases after 1 year and 280 cases after a follow-up of 16 years. Summary data observed in our city are similar in those of Lakhdar, Brown, and Keving. A summary of post-operative complications were middle hypoesthesia in 937 cases was a minor complication we wanted to have for certainty of a long data relief. Severe hypoesthesia, anesthesia dolorosa in 18 cases. Coronary reflex diminished in 8 cases. Unilateral blindness in 2 cases. Otalgia or hypoacusia in 142 cases. Transient complications included masticatory weakness in 82 cases. Paralysis herpes in 56 cases. Cranial nerve palsy, 5 cases, third, 3 cases. 2 patients developed infection complication, abscess, one in intracerebral and the other in one located in the cheek. 1 patient developed a cavernous carotid fistula. We deplored in the beginning of experience 1 death following a brainstem injury 3 days after surgery. Rare complication, cerebral abscess to a 35 years young woman treated for 6 weeks, MRI control disappearance of the abscess. A cavernous carotida fistula observed 3 months after the surgical procedure. Good results after embolization by our colleagues radio surgery. The 3 landmarks of the arterial route, the first point, the second, and the third. The introduction of the introducer is done from the first point, as seen on the video. The progression towards the foramen oval is done through the C-arm fluoroscope. This technique needs an intravenous silicone catheter, a number 4 Fogarty catheter, contrast medium, and C-arm fluoroscope. As we can see in this video, number 4 Fogarty catheter, which permits to inflate a balloon to its extremity. The metal introducer is removed. An outflow of CCF. Introduction of the Fogarty number 4 catheter. Inflation of the balloon with contrast medium 0.7 cc for 6 minutes, always with fluoroscope control. Showing a pear shape of the balloon located on the retrogastrian ganglion. This technique may encounter the impossibility of penetrating the foramen oval. Capablanca in 1989 had 11 cases. Then he reoperated them 2 weeks later. In our city, we had 22 cases who had to propose to our patient other technique, microvascular decompression. Some others were helped by the TDM. In our department, Seraton peroperative or neuronavigation to cross the foramen oval. The directory abnormalities may exist. The introducer is directed more posterior, an inflated balloon through the superior orbital fissure. This is an act which is strictly forbidden to do it. The balloon compression is performed through 4 parameters. Volume of the balloon 0.7 cc, duration 6 minutes, has a pear shape in the X-ray. The balloon is located on the triangular plexus. There are the parameters which permit to have good results. The literature study for a long-term outcome on the treatment of the trigeminal performed by Kompolat and Mark Sendu in March 2003 and published in Acta Neurochirurgica, the long-term outcome efficacy of microvascular decompression and percutaneous balloon microcompression were similar, and their effects were superior to those at the other modality. The recurrence rate was high after thermocoagulation, the lowest recurrence rate after microvascular decompression. In conclusion, the study suggests that each surgical technique for treatment of the trigeminal has merit and limitation. When we have a patient who suffered like this in this video, what do you propose for him? Radiosurgery or microvascular decompression? And we observed him a few hours after surgery. In this situation, good results after surgery. I think that percutaneous balloon compression technique is easy to perform, give an excellent pen relief with acceptable morbidity if recurrence can be repeated. Thank you for your attention.